That's how I like to think of AI, is it's assisting doctors in making decisions rather than giving them the decisions.
Healthcare is a unique industry. From the start of our lives to the end, we are all destined to interact with the healthcare industry at multiple points in our lifetime. With growing concerns about affordability and access to high-quality care, it has become increasingly important to think about where healthcare is headed in the future. For example, what does the future of healthcare look like with the advent of tools like AI? And how can business researchers contribute to the challenges ahead? Welcome to Inside Alvarez Business, a podcast dedicated to bringing you the stories behind the research. I'm your host, Jonathon Halbesleben, Dean of the Carlos Alvarez College of Business at the University of Texas at San Antonio. This season, we'll focus on the business of healthcare, sharing the stories of our faculty, the real-world impact of their research, and what led them to study these important topics. I'm delighted to bring you this conversation with Arka Roy, Associate Professor of Operations and Analytics here in the Carlos Alvarez College of Business. Arka's research in optimization, analytics, and AI is focused on finding ways to improve the work of healthcare clinicians. Hope you enjoy this discussion as much as I did. Well, welcome to Inside Alvarez Business.
It's really a privilege to be here and talk to you and share some of my insights. Hoping for a wonderful fireside chat.
Okay, well, I'm excited to hear the sort of the stories behind your research. So that's really what we're kind of focused on with the podcast is understanding the research, but really kind of the story behind it and where it came from. So before we get into your research, though, I want to ask you a question. I don't think anybody has ever, when they were a kid, said, when I grow up, I'm going to be a professor. Or, like they don't invite me to a career day at school, right? How did you end up going down that path?
So growing up in India, they value a lot of education. Education was always in my family. My parents always told me to get more as much as possible. And coming out of undergrad, I did an internship at Motorola, and things I was doing at work didn't really have a tangible output that could really make a difference. Mm-hmm. And so I kind of thought, okay, how can I make something that I felt full ownership over? And so I went back into graduate school to do a master's, and probably about halfway through, I was like, you know what? If I'm going to get all this time and spend effort into it, I might as well go do a PhD. You get to solve a bigger problem, something that really makes an impact. I loved teaching. I loved mentoring junior people. I loved seeing that light bulb go off in students where they learned something. And it was just the perfect fit of all those things that come together in academia, where you have the flexibility to have your own schedule while also impact young minds. Financial freedom or reward wasn't necessarily my top thing that I prioritized. And so the academic job felt like a perfect fit.
Were there people kind of along the way that encouraged you down that path, or did you just kind of figure that out on your own?
I remember my, possibly 11th grade math teacher in high school was a big impact in kind of making me feel confident in my abilities more than just not about the material, but rather building my self-confidence.
Mm-hmm. I think back to my own education and career, and I guess primarily education and the professors who I remember the most. I don't know that I really remember much of anything from their classes. I just remember kind of the interactions with them and the way they approached learning. And
so the way I teach, like when I teach topics here at Alvarez College of Business, I set up sometimes like competitions for analytics, and students will try to figure out how to build best models that they can kind of have a friendly competition towards. Those kind of things help you learn.
Then in your research, you've done a lot of work in healthcare. And I'm curious what led to that particular industry as far as kind of focusing your work.
So I think there are probably 3 pivotal moments in my life that led to my healthcare research. So, coming from a traditional background home in India, medicine is always one of the top career choices that you can take. Mm-hmm. So being a doctor was always at the forefront of something that I thought about growing up. But then about 10th or 11th grade, they did, I forget what the procedure was, but they put a camera up my nose and then they showed it to me on the television, and I almost fainted when I saw that, right? It was just not my field. And so I went down the math part and I did an industrial engineering undergraduate. And then going into graduate school, I came across a professor who did research in applying industrial engineering concepts, or, really optimization concepts in the field of cancer radiation therapy. So that was my kind of way back into healthcare, if you will, really in healthcare, not just operations, but healthcare treatment decision making. And that was important for me because I wanted to be in somewhere where I could actually help a patient in their treatments, right? To help them overcome that. So that was a big moment for me to come back into healthcare. The first probably pivotal moment. And then the second pivotal moment was as I was getting into this field, one of my close friends who was about 26 years old, she developed breast cancer. After remission for a while, the tumor metastasized to her lungs and then ultimately to her brain, and she passed away after about a few years.
Oh, I'm sorry.
So that was another second very important moment that kind of gave me purpose towards doing research in this area. A lot of people ask me, how come you do clinical, research that not necessarily is traditional business? And I'm very fortunate that at Alvarez I get to do that. But that purpose gets kind of sent down, and I've enjoyed being able to give back to that community to do research there. And the third pivotal moment was when my son was about, I think maybe 8 months old. Every time I would put him down, he would really start crying, and he would keep his right leg kind of furled up and have some kind of trouble putting pressure on it. So we called the pediatrician's line. The nurse told us to take him in. So we rushed him to Dell Children's. We do an MRI after 2 hours of waiting. And it turns out to be a septic hip.
Oh, no.
He needs surgery the next morning. Every time they tried to put a needle in him when he's trying to get him fluids and stuff, he starts crying uncontrollably. We find out that he has something called breath holding spells, where kids can cry and eventually not take breath because they're in this weird zone, and they turn blue in your arms, and the entire hospital rushes in to resuscitate him. And I learned that there's all these chaos that are happening in a hospital, in the operations of a hospital. And in the middle of those, there are teams of nurses and surgeons that essentially have to clock out and clock in. And you have to explain your situation to the different people multiple times. There's just a lot of, I wouldn't say inefficiencies, but just uncertainties that are involved in the system that you have to take care of and you have to account for when you're building schedules and, any kind of operations decisions. So that was the third pivotal moment where I thought, I could probably make an impact in the research that I do in these areas and get the reward that I originally had for working in the field of medicine.
I can recall within the first hour of a handoff is like the most dangerous time if you're in a hospital setting because of that transition and the lack of communication. So I am glad that your son's doing all right.
He's very healthy, and is a 7-year-old that's running around and jumping off the building almost.
And those stories are so powerful. I can definitely see why that would have led you to want to make a difference in healthcare in particular. And while I wish those things hadn't necessarily happened to you, in a way, I'm glad that it's led you to do some really, really cool work. I know one of your recent studies was about anesthesiologists and how they get scheduled. And so I'm kind of curious, what was it like before this study? And then, what did you guys kind of figure out there to make it better?
So actually, this study started through discussions with the chair of anesthesiology, Dr. Frank Rosinia, who was at UT Health at that time. And he was very aware of the impact of analytics and informatics that helps in hospital operations. We started to identify some of the challenges that they face every day in creating these schedules of anesthesiologists. They have contracts that they have to meet in order to supply anesthesiologists to go essentially meet the demands that shows up at UHS. And so a lot of times there are certain inefficiencies and also preferences that come from anesthesiologists that are unmet. The discussion we had was, how can we build a fair, equitable sort of a workload that is balanced across people, across time, while making sure that the hospital system is as efficient as possible. So we built a mathematical model that uses multi-objective programming, a field that has existed for a long time, where that looks at trade-offs and different objectives. So one of the objectives was, can we make the shifts as equal and balanced as possible across all the anesthesiologists? Another objective was, can we make it as equal and even over time? So if you had a really rigorous, complex cases shift that you worked on Monday, perhaps you don't get it again till Thursday or
Okay.
Friday, right? To do that manually would take you hours just because there's so many different decisions that you're doing. You have a set of 40 to 50 anesthesiologists. You have multiple days of the week. You have multiple shifts. You have multiple other constraints that you have to take into account. So we built this multi-objective program and solved it using, some of the state-of-the-art computation that's available at Alvarez, and was able to actually implement a solution and show that it actually led to improvement in satisfaction.
That's cool. So satisfaction among the team of anesthesiologists.
Correct.
Oh, that's really cool.
Our takeaway from that was actually dollar savings, because that was the time that they could have been spent in the clinic. Right?
Yeah, absolutely.
Treating patients.
I imagine insurance doesn't reimburse for someone sitting down building a schedule.
Right.
Yeah. So you measured satisfaction. Have you extended that to other markers of well-being, like stress, burnout, any of those types of outcomes, or maybe that's a future study?
That's a really good point. We haven't really extended that per se, and we've talked to them about it. We have shifted direction a little bit more recently. So at UT Health, there are 3 stages of the problem that we study. One is at a much more long-term 6-month, 7-month scale, where the chair of the department wants to know how many anesthesiologists do they need to have in order to satisfy demand 6 months later. The midterm problem is, how can I assign different people, the anesthesiologists, different schedules and different days, so that someone's leave that they want to take 2 weeks later or 3 weeks later is also satisfied. And the immediate problem that they study is someone who's called a board runner, who essentially on the day off, after all the emergency demand has come in, how do they reallocate everyone so that all the necessary supply is met by the anesthesiologists? Right. So that we sort of shifted from the long-term, midterm view after solving that problem to a much more short-term view, where we're looking at, can I meet preferences on an individual level of anesthesiologists on that day off problem, and create teams of people where they get along much better with each other. And we use some of the more advanced and modern machine learning models that and from recommendation engines. Think your Netflix. When you watch a movie and movies that have certain genres, you get sort of your thumbs up and you give it, right?
Yeah.
And they recommend it back to you.
Oh, that's interesting.
So that's the kind of work we're doing. We haven't expanded it to a burnout or stress environment, but those would be really cool things to look into.
Yeah, that last piece is so interesting to me. Then to schedule them as teams is not really feasible. I mean, if somebody needs off one day, then the whole team can't go. But to use that kind of recommendation system, that's really fascinating.
Yeah, so you need a sort of a secondary layer of an optimization precisely of what you said, right? Suppose you create these teams, but then someone's out on that day because they're sick or something. So you need an optimization to reimpose those constraints so that you get re-optimized solutions with people that are available.
Yeah. What was your experience as you worked with those groups?
Honestly, I think the success of the project has heavily relied on the buy-in and engagement of the providers that was there. One thing we learned was let's keep the math and the optimization systems as simple as possible. We had to break this up into, instead of a more complicated 2-stage model, into a 2-step system where the 2 steps were actually not connected from one another.
Okay.
And let them see the output of the first step, which was to design shifts that were sort of balanced and met the necessary demand that we were forecasting. And then in the second step, assign providers into those shifts that we designed in a more equitable fashion. That allowed them to kind of replicate the manual process that was happening in an automated way.
Yeah.
Right. So to have that buy-in and engagement that we had from them through every weekly discussions and meetings, and to iteratively improve the model from little steps, from a single step solution to a 2-step solution, and explain to them how this is sort of the simplest way to deal with it, was probably the most important thing towards the success of that project.
Yeah. Well, it's so thoughtful. And they might not have seen that it really, all of the same thinking that went into the manual process went into it, just much better.
Right.
But they wouldn't have seen that. And so that's really thoughtful to kind of build it that way. I can see how that would have made it much more successful.
100%. And I think, sometimes we solve these problems using really, really complicated methods, and then we implement it, and then perhaps it gets used for a week or two. And then if that student or person leaves the system, it just doesn't get used, right? So you need to have the right culture in place with people who are going to be analytics driven or think about it quantitatively. You also need to have simple steps in process, because in a healthcare setting, particularly, clinicians are thinking about saving lives and treatments. They're not thinking about how can I optimize these.
Oh, that's really cool. So switching gears just a little bit to another topic of your research. I know you've done some really interesting work with radiology. Can you talk a little bit about some of the work you've done there, some of the problems you've been working to solve in that arena?
Let me give you a little bit of background about cancer and radiation therapy and how operations research comes into it.
Okay.
So typically in radiotherapy, there are, I would say, multiple modalities, but two of the more modern and popular modalities is proton therapy, where think about really, really large particles being shot towards you from an external source, and you can control the depth of the energy that's deposited in your body. And so it gives you some additional degrees of freedom to control the radiation. You're able to optimize and figure out exactly how to deliver that dose. So you have a really high dose on the tumor, and you try to minimize any surrounding dose on your healthy tissue. Now, instead of using proton beams, you can also use photon beams. That's also probably the most popular choice. And there, it's a little bit harder to control the depth of the energy deposition. Think about it like a cookie cutter just goes in and destroys the tumor cells. But you try to give lots of radiation from multiple different angles so that when they converge on the tumor, there is a high uniform dose. And so to do that, there is a very, very large-scale optimization problem that gets solved. And you try to solve this optimization problem over a large scale so that you maximize dose to tumor, minimize dose to surrounding healthy tissue. So that's really where my optimization background comes in. Now, this field has existed for decades. The more modern problems that people study are uncertainties that exist in this space. So for example, when you go in for treatment, if you have lung cancer, you can't really hold your breath for the entire treatment. Right. So your lungs are moving in a cyclic pattern. So with motion, perhaps sometimes you sneeze, that goes out of also that cyclic pattern. Can I capture those patterns or even the worst case sneezes in my modeling of the treatment so that in the worst case, your dose is still going to be acceptable, while in the best case, you're as close as possible to the optimal? We have taken some of those tools and extended it past motion to look at tumor shrinkage. Can I build AI models to predict those shrinkages? Can I adapt my treatment based on those predictions of how the tumors will shrink? We've built optimization models to model how will the biology of the tumor cells change over time. Can I also account for uncertainties in those predictions and then build optimization models to account for that? So I've done a lot of work in uncertainty management in cancer radiotherapy from the optimization side. Wow.
And are you seeing some of this get applied? How do you get that into practice?
That's a really good question and a hard one, because in healthcare, in the operations field that I talked about earlier, that's a quality improvement project with anesthesiologists. That is really easy to implement. But when it actually impacts a treatment, then you have to go through multiple layers of protocol and clinical studies.
Right.
So what people study today, I would say 10 to 20 years later, after clinical studies have gone on, I have seen vendors adopt that. So the AI models that the vendors are using now have been studied for many, many years before in cancer radiotherapy.
Yeah.
And so the research is definitely way ahead of actual practice, but the onslaught of the research that we do today definitely does impact what happens in practice.
So you mentioned AI models, and I know some of the work you've done in the past and how we're doing now, it relates to implementation of AI models or machine learning models in healthcare contexts. Kind of broadly speaking, maybe extending beyond your research, how do you feel about the future of healthcare relative to AI?
I'm very optimistic because I think doctors are trained really well in their fields that they know what are the limitations of AI when they use it. When I have discussions with physicians, they want to know what are the limitations that AI will have when it makes recommendations. Eventually, the argument is AI is going to at least automate a lot of the tedious and more time-consuming tasks that the doctors do themselves.
Yeah.
So if the AI can do that while producing some sort of confidence in its predictions, the doctors can always make an evaluation on the actual prediction by saying, okay, the AI is 90% confidence. I'm fairly okay with it. Let's go ahead and implement it. When the AI is 10% confident or 20% confident in the predictions it makes, I'm going to review it. So at least it reduces that burden on the physician themselves when they're making the treatment. I'm looking at how some of these models can perhaps be translated and used in lower economic settings where treatments to cancer therapy is quite expensive. If we can take AI models that's been built at, let's say, for example, MD Anderson or in Mays Cancer Center, and be taken to East Texas and be implemented there, it can make access to those treatments much more affordable. It can perhaps reduce the geographic distance that a patient has to travel to get the treatment. And so it helps kind of overcome some of those barriers.
Yep. Healthcare seems like it's a little unique that way in the sense that there's already dramatic shortages in healthcare. So I see it taking many of the parts of the job that aren't the desirable parts of the job and taking care of some of those things. I think about my primary care physician uses the system where it listens in and does the notes. And he just loves it. He said it saves like 3 hours of his day not having to do all the charting. I'm optimistic in that sense that it will help protect in some ways the well-being of the people who are in the industry, while also helping just to kind of increase the capacity in a lot of different areas.
100%. I actually have a close friend who does exactly the same. He uses the same system on scribing and automates that whole process. And that's how I like to think of AI, is it's assisting doctors in making decisions rather than giving them the decisions.
Yeah, just more to the process of your research. A lot of the work you've done has involved postdocs. And some of the really cool studies you've done have involved postdocs. Talk a little bit about the value of that mentoring relationship.
And I think mentorship is a big part of the appreciation that I have for research. So I've always enjoyed working in teams when I'm kind of looking at how to solve a problem. I've loved talking about it. I've loved thinking through things with other people. And so locking myself in a room and just doing individual research has never been appealing to me. I kind of share a lot of that with the mentorship that I give, not just talk about research, because otherwise I think it's very easy to fall into that trap of just like publish, try to get into these top journals all the time. And sometimes that can get unhealthy. The people that I've worked with, I think, has appreciated that fact that I can talk to them openly about it, I think. I can talk to them about my failures that I've had plenty of over my academic career, that I think are the things that I struggle with, the things that I have issues of imposter syndrome, or, how do I handle that? How do I handle the stress of working and the stress of tenure track life? How did I have 2 kids while going through tenure track life? A wife who's an academic who also has a very stressful job, is tenured now. So talking about all those things with PhD students and postdocs who are kind of either going to go through it or are going through it has allowed me to create sort of, I would say, mentorship, relationship, friendships that works well for my personality.
Yeah. I have to think that given the nature of the work that you're doing, that sort of practical application, and even if it takes quite a while for things to actually happen in practice, you can see it happening in practice. I have to think that helps with the kind of plateauing piece of it.
Because it's so practical, there's always a next question that comes out of the research that I do.
Yeah.
I think that's what probably motivates me to keep going and be curious and continue the research on that side. If you look at my research output, really, have a diverse output set, and some people might find that good, some people might find that bad. But I think to me, I want to be able to reach the clinicians that are going to read my work, because I want them to use it.
Yeah.
There is no better outlet for me than to get some of this work out in the radiation oncology journals or in some of the anesthesiology journals, while making sure that I'm also staying in my field of business and publishing in operations research journals.
I appreciate that you've taken that approach. I mean, I think that the best thing we can do is get the work to the people that need to use it. So I imagine it also helps with motivation. I know for myself, part of the reason I'm I kind of went into psychology, besides that I couldn't pass organic chemistry and become a different kind of doctor.
It's a difficult subject.
But people are always going to do weird things that are going to be interesting to study, and so there's never if we ever reach to the point where people stop doing weird things and we're just fully predictable, well, I guess then I can just be done. But I have to imagine sort of in healthcare too, there's so many things that go on, and then it changes. And as new technologies come into play and all this, it always gives you something.
Especially with AI, I think the field has changed so much that there is now probably way more open questions than closed questions.
Yeah.
I really think there is a gold mine of more research to do now in healthcare.
Yeah. On that note, what's up next research-wise? Or what are you working on now that you're excited about?
There's two pieces of research in healthcare that I'm really excited about. One is very practical. I'm collaborating with Children's Health, which is a very large hospital out of Dallas, with some collaborators out of Cox Business School at SMU and University of Washington Engineering School, as well as postdoc Catherine Adams that's here. We're all a team that are looking at building reliable and resilient surgery schedules for their surgeons, implementing machine learning models and some of the more state-of-the-art models to make predictions and then make decisions based on those predictions. And then on a probably less implementable but more of a conceptual question is something in the area of cancer, but also on a larger scale. How do we bring these AI models and predictive models along into a decision-making framework? How do I make my subsequent decision-making model or optimization model that can handle those errors in the machine learning model? So conceptually, that's what I'm really interested in, is at this intersection of predictive and prescriptive analytics, where you make decisions based on the predictions, but from an uncertainty management perspective.
Yeah. I'm so glad on the first part you talked about, that you're working with Children's Hospital, and because I think reliable scheduling is important and helpful in any context. But I mean, you're a parent, I'm a parent. We're talking about children's surgeries. It's it feels like the reliability of the schedule and knowing that the surgery is going to happen when it's supposed to happen, or at least close. The sort of stakes. They go up a bit more when you're dealing with the parents and
Very much.
The emotions with it. So I'm glad that that's the setting that y'all are working in.
There is multiple stakeholders in this, right? So there is the patient's perspective, which includes their parents, which includes making sure that the schedule that you set out is reliable, like you said. So the patients that are coming in from low-income backgrounds that have to travel multiple hours to get there, someone has to take off days of the work week, right, to bring their kids in. That is reliable. But then there's also the reliability from the physician side, which is they want their schedules to be as accurate as possible, so that when they wake up at 5:30 a.m. and they have to rush in for the surgery, they know that they are not going to be waiting around for someone else to finish, so that, they meet their necessary obligations. So, and then there is the hospital perspective, which is they want to get as many patients as treated as possible, right? Without having to push surgeries onto the next day. So
well, when you're not working on research or thinking about research and teaching and all of that, what other things do you enjoy in your life? One of the things I kind of want to emphasize is that we are humans doing this work.
I've got two big loves. One is Manchester United, watching soccer. So I do watch a lot of soccer on the weekends with my kids in the mornings. And probably the biggest love is traveling.
Okay.
So we've traveled around the world a lot of times. My 7-year-old has been to 17 or 18 countries.
Oh, wow.
Every chance we get, we try to be somewhere else in the world while doing our work at the same time. And I think that's the biggest sell for academia for me. I want to be able to be somewhere else where I can show my kids different cultures that exist, different food that exists, different types of humans that live there, but they need to understand, there are a lot of other people that live in this world from different backgrounds, different socioeconomic statuses, and have very rich lives from different cultures that they grow up in. So we try to show that to them every opportunity that we get.
Well, that's wonderful. I appreciate that you're doing that. I mean, just
thank you.
Thinking of the future of humanity, the more of that we can, instill in people, in our children, I think it's just going to make for a better world overall. So I'm really appreciative that you're.
And academia allows me to do that. So I appreciate academia for letting us have these flexible schedules and being able to show up to my kids' dance recital or some of the other things that I do and still be able to be successful in academia.
Yeah, and while still also making a huge impact with the work that you're doing.
I appreciate it.
Well, Arka, it has been such a joy to talk with you today. Thank you for the work that you're doing and your drive to try to make it a better system for all of us. So I really appreciate that and wish you the best of luck as you continue your work.
It is a pleasure, and I'm so thankful to have the chance to sit down with you and talk about these things.
Thank you for listening to the Inside Alvarez Business Podcast. Special thanks to our producer, Brittany Johnson, and for the support of Wendy Frost and Melissa Lackey to help make this podcast possible. Stay connected with the Carlos Alvarez College of Business at the University of Texas at San Antonio to learn more about how we are empowering the next generation of business thinkers and conducting groundbreaking research to ensure their success. Follow us on social media or visit us online at business.utsa.edu. Until next time, I'm Jonathon Halbesleben. Thank you for listening.